Good evening everyone. Today our class is about lower end of femur bone. Before starting class, please subscribe to our channel and follow us in Instagram for notes. Notes is given for examination purpose and is clearly explained in this class. Today our class is about the lower end of femur. Now coming to the lower end of femur. See, the lower end of femur has articular surface. Femur has articular surface. Next one, lateral condyle. Next one, medial condyle. Articular surface, lateral condyle, medial condyle, and intercondylar fossa or intercondylar notch. These four concepts we are going to discuss in today's class along with the clinical anatomy. Clinical anatomy is included in upper end also. Okay, yeah, this concept is very important for 5 marks. Frequently asked question along with this upper end of femur. Now coming to the main features of lower end. See, lower end is wider part. Lower end is wider part with two condyles. One is medial epicondyle. This is the lateral side. This is medial side. This is anterior view. This is posterior view. Now coming to the point, it is wider as well as it has two condyles. It is medial epicondyle, it is lateral epicondyle. See, we can see clearly that medial condyle is larger than the lateral condyle. Okay, next thing, here it forms the articular surface to form knee joint. Okay, this lower end of femur has articular surface to form knee joint. Okay, now coming to the main points of this lower end of femur. The first concept is articular surface. Articular surface helps to form knee joint, and this is the surface, articular surface. And here it has two condyles from the anterior region. This is anterior and this is posterior. Now coming to the anterior region, anterior surface forms articular surface in the anterior region forms for patella, covers anterior surface of both condyles. Articular surface for patella covers anterior surface of both condyles. See, in the anterior surface it extends more on lateral surface. See, this point, this view, this I will draw with I will tick with this red color. This entire part is articular surface part, and this articular surface part is more on lateral side. See, we can see clearly that it is more than in lateral side, than medial side. Next, it separates from tibial surface by two faint grooves. Next thing, coming to the tibial surface. The tibial surface covers the inferior and posterior surface of two condyles. This is the tibial surface. I will draw with this. I will tick this red ink. This surface is called tibial surface. This tibial surface covers the inferior and posterior surface of two condyles. This is the posterior region, and it covers the posterior as well as inferior region of two condyles. This is the tibial surface. Now next, it coming to the point, it merges anteriorly. It merges anteriorly with the patellar surface, and it extends short and straight on lateral surface. See, it is very straight and as well as short than medial surface. So here the lateral surface is more. Here the lateral surface is short, and here medial surface is more and curved. See, it is curved like this. So the medial surface is more and curved. This is medial surface. Next, this is about the articular surface. Now coming to the lateral condyle. Lateral condyle is flat laterally. See, this is the lateral condyle. It is flat laterally. It is more in line with the shaft, and it takes greater part in transmission of weight to tibia. See, important point, lateral condyle forms the greater part in transmission of body weight to the tibia. Next, but it is less prominent than medial epicondyle. It is less prominent than medial condyle, but it takes greater part in transmission of body weight to the tibia. Next, lateral aspect has some prominent characters. Those are lateral epicondyle. On the lateral side we can see lateral epicondyle, and it has popliteal groove. Lateral epicondyle, it has popliteal groove, as well as this lateral condyle has a muscular impression on posterior superior to the epicondyle. This is about the lateral epicondyle. Next, coming to the medial condyle. On medial condyle is convex medially. See, it is convex medially, and it is most prominent point on its medial epicondyle, and it has adductor tubercle. Medial condyle has adductor tubercle. This is called adductor tubercle. Medial condyle has adductor tubercle on posterior superior to, see, this is the posterior and superior region. This is posterior, we can see clearly from posterior region, posterior superior region, and this tubercle is very important landmark. By this tubercle we can determine its side, as well as it helps in to keep the bone in anatomical position, as well as it is most important site, as the epiphyseal line has passed from this adductor tubercle. Here the epiphyseal line passes like this through this adductor tubercle, so it is the important landmark. Next, these are the important points that regarding to the medial condyle. Next, coming to the last point, intercondylar fossa or intercondylar notch, and this part I will draw with this blue. This part is called intercondylar fossa or intercondylar notch. It separates lower and posterior parts of these two condyles, as well as it is limited anteriorly, and from seeing here it is very limited because you cannot see it clearly, as there is articular surface is present. On the posterior surface we can see it clearly posteriorly by intercondylar line, which separates the notch from popliteal surface. This surface is called popliteal surface. Okay, it separates the notch from popliteal surface. Next, all these are the important points that regarding this lower end. Now coming to the clinical anatomy of the femur bone, along with both shaft, lower end as well as upper end. Now coming to the clinical anatomy, fracture of shaft is most common in people below the age of 16 years. And bucket handle tear is common in people at the age of 14 to 40 years. And Pott's fracture is common in people between the age of 40 to 60 years. And at last, fracture of neck of femur. I will provide the pictures in Instagram. Fracture of neck of femur is common over the age of 60 years. For old people, there is fracture of neck is common for the old people. Next, we have discussed in upper end that it is supplied by retinacular arteries as well as branches of medial circumflex femoral artery, as well as retinacular artery. Okay, as these arteries gets injured, if these arteries get injured in an intercapsular fracture of neck of femur, it leads to avascular necrosis of head. Avascular means there is no arteries and veins passes through the neck. Necrosis means death. So the fracture of the injury of these two arteries causes a vascular necrosis of head. All these this is all today for the class, and tomorrow we will meet again. Thank you all.